Hello friends, it's me Kaushiki Dwivedi here, and what I intend to do is to make a series on cervical cancer screening, as well as, which is also called Pap Smear in common terminology. But not just that, but also to talk about that why cervical cancer happens, how we can prevent it, and if in case you come across with a Pap smear report which is abnormal, then how to go about it. So though there are several videos and which is very good, which are on how to do the Pap smear and why to do a Pap smear, but there are not many video by Indian content creators as to how to follow an abnormal Pap smear results. So this series is all about it. Today we shall be talking about it, why we should have cervical screening test, and which was also called as Pap smear in past. In Indian context, Pap smear is still being very commonly used, but globally it has been replaced by cervical screening test. And what is the difference and why we do it, that is what we will talk in this video. So there is a group of viruses, just like we have so many viruses in the world. Just like we had COVID virus, we have influenza virus, we have another group of virus which is called Human Papilloma Virus. And this Human Papilloma Virus is something which are many varieties of it, like there is more than 100 varieties of Human Papilloma Virus. So few of these varieties of Human Papilloma Virus is known to cause cervical cancer, and that is why cervical cancer is something which can be considered to be viral in origin. In 99.9999% it will be caused by a virus, Human Papilloma Virus. Now, as I said, there are more than 100 variety of Human Papilloma Virus, and they are named with number HPV 1, 2, 3, 4, 6. So like HPV 16 and 18 are considered to be the ones which are associated with cervical cancer most often. So when you go for a cervical screening test, and who should have, let's start with it, who should be having cervical screening test? Any female between the age of 24 to 74. Mind it, 24 to 74. It is not just that those who are sexually active, even after menopause, which is up to the age of 74, one should get cervical screening test done. Who can do it? Any qualified gynecologist or a general practitioner, female practitioner who is well versed in taking Pap smear can take the sample for cervical screening test, and the test is done exactly in the same way as the Pap smear was done, with a brush which is similar to a painting brush. Through that, cells are taken from your cervix. It is an outpatient procedure which doesn't involve pain. There might be slight discomfort. It hardly takes 2 minutes of your time in your life, and that too every 5 years. That's all what it needs. So visit a gynecologist, get your cervical screening test sample done. And as I said, I've already mentioned the age group, which is 24 to 74. So after that, what happens is that the gynecologist or the hospital will get the sample sent to any good lab. In the lab, the pathologist will give a report whether there is a Human Papilloma Virus or not, whether HPV is present or not. And if HPV is present, then the cells there which are taken in the same sample which was taken for Human Papilloma Virus, it can be examined in the lab to comment whether they see any abnormal cells there or not. That is what was tested in Pap smear previously. In Pap smear, the Human Papilloma Virus checking was not involved, but it was found that Human Papilloma Virus checking its presence or absence was much more effective in telling whether a person will have cervical cancer or not have cancer, rather than just commenting on the cells. So that is why and how of it that we get the cervical screening test done, as the name mentions, to screen out that we are not developing cells in our cervix which can lead to cervical cancer. And as I said, 99.9% of them are caused by Human Papilloma Virus. It is tested by gynecologist. The sample is taken by a gynecologist or a GP who claims that he or she can do Pap smear, and the sample is taken and then tested in a good lab, and the lab then gives a report whether there is a HPV present or not present, or if there is abnormal cells present or not present in the sample which was taken from you. Based on the report of the sample, it would be decided that further how we are going to take care or observe or follow up your cervical cancer screening. So this is how and why, and on this note I am ending this video. Next will be, suppose you have gone for a cervical cancer screening test and you find an abnormal report. Now recently one of my patient, at the moment I'm in Australia, my patient is in India. I referred her to somebody and then she had some abnormal result which made her really anxious. Now as in India we don't have a well-defined cervical screening program, so it confuses everyone. It confuses even the gynecologist, it confuses even the patients, because when you don't have well-defined guidelines, you try to manage as per your own created guidelines, which can vary from doctor to doctor and patient to patient. So that's why I thought of the whole you can say inspiration for making this video came from there. So in next video, which is a very important video which no one tells you, that how an abnormal cervical screening test report is to be followed, that is what I will be talking in my next video. So do stay tuned for it tomorrow, and then you would understand a lot more about it. In the meantime, if you have any questions which you would like me to answer, please feel free to put down in the comment section below, and I will be more than happy to answer, as I've already said. So till we meet next time, have a great weekend or week ahead. And if you have already not got a cervical screening test done, then you should get one done. And one important question, that how frequently it should be done. It should be done every 5 years, assuming that your last cervical screening test report was normal. You should get it done after 5 years. Cervical screening test is when your human papilloma virus plus liquid based cytology or the cells have been tested. If you just had a old conventional pap smear where your HPV was not tested, then within 2 years of your normal pap smear, you should come into this system, which is the cervical screening test system. And then if everything comes out fine, then you should go for it every 5 years. So as I said, if you haven't been to a gynecologist, do go get it done and come back tomorrow. We will discuss what happens if anything comes abnormal in the smear.